right. Well, hi. Thank you, Yuli and Raj, for having me. It's really a thrill to be here tonight. I love this organization. I congratulate you on another amazing event with so many people. So many of you may know me, many of you may not know me. I'm a surgeon. I'm a vascular and general surgeon. I'm the daughter of a great surgeon. I'm married to a surgeon. My brother's a surgeon. 2 uncles are surgeons, all in Massachusetts for a collective century. I do not like healthcare and the way it's going, and I thought I could write a bunch of angry letters or I could try to change it. So I instead said, well, I'll put my money where my mouth is. The kids are in college. Let's try to disrupt healthcare. So what's the problem? It's just too complicated. Patients can't get to a specialist. It's inconvenient, it's expensive, there are long delays, there's restrictions, there's no price transparency, and there's been a huge increase in out-of-pocket expenses. For doctors, it's the same. It's inconvenient. It's expensive. There are delays in payment. There's practice constraints, and they're limited by insurance restrictions. And many services are either underpaid or simply not paid at all. And now COVID-19 has literally changed everything, which has forced doctors to have to make a rapid adoption to digital healthcare. And I should say the patients too. And it's important that we understand where we're headed. So what's the solution? Well, why couldn't we just make it simple? If we gave patients direct access to specialists for a transparent price, a fair price, we give doctors the tools to create their own digital office, and we've essentially created a new marketplace with the only 2 stakeholders who really matter, the physicians and the doctors. And that's what we have done with UberDoc. We started this project back in, we thought of the idea in 2016. We've been out there. We've built this big network. UberDoc is a platform. It provides priority access to the best specialists for an affordable, transparent price that you can pay through your health savings account of $250 for a consult and $50 for Medicare patients. Doctors can be found easily, listed by proximity and availability. Patients can simply make an appointment using their credit card or health savings account. And we've made this at the level of a 4th grader for both the patient and the doctor. We call our platform anti-epic. So how did we get here? Well, we started in our MVP, we started as a subscription. We went to doctors and said, would you take a patient for cash? And if they didn't show up, you'd still get paid. They're like, sure. So basically, every doctor I talked to said we would happy to take a patient for cash, a little less than they get from insurance, but above Medicare to be legal. Well, what happened was that the doctors were they were interested, but of course, without the patient network, it was going to be hard for them to do that. So we decided to pull the subscription and instead allow the doctors to come on without any obstacle. And so we ended up with a high doctor growth. We had tremendous success in market automation, but we weren't kind of getting the patients right away. So then we started to find that as we built this massive doctor network, because everybody kind of wanted to join, it was a marketing tool, it was a way to have a digital office. Next thing you know, we were approached by technology. Telemedicine came to us and said, we love your model. We want to bring telemedicine to brick and mortar doctors. This was a year ago. And here we are with all of these partnerships now. And all of a sudden, so many people are coming to us with their technology to introduce to our network of doctors. And we have now consolidated white labeled solutions, and we have now gone back to that revenue model of a stable revenue growth. So what we've in fact done is created this single marketplace where doctors can find those tools that they need to build their digital practice, and the patients can find convenient access to care. I like to say we've created an army of doctors that are willing to go after and take back healthcare. And how is this doctor network growing? Well, you can see from our graph on the left, we are growing exponentially. I have to say that probably COVID really catapulted us as doctors were looking for telemedicine. They were looking for cash options. They're looking to try to stay in business. And all of a sudden, UberDoc is that solution for them. And so we've had this massive and rapid growth in our doctor network. And with this doctor growth, people have come to us. So we have all of these are just some of the of the organizations that we're working with right now. So we have people from finance, Mission Growth Investments, a group of syndicate doctors. Global Health Impact Fund was our first investor last December, our first big investor. We have most of our investors actually are physicians. VC came to us and said, let's do this. Let's bring telemedicine to specialists, and let's do it on a cash model. And also we have other organizations that are supportive. We have so much technology coming our way. Quadrant Eye, this really slick eye test. OptiSurge, we heard her present a month ago. She wants to bring her glasses to my surgeons. NeuroView, this really smart neurologist who has a really interesting exam that can screen for stroke, that can connect to a doctor, a group of neurologists that could, or internal medicine doctors that can assess somebody's risk for stroke. And of course, organizations like AID, Innovator MD, and even the government. Believe it or not, the government is very interested in us because we are getting our GSA. We're a New England vendor now for telemedicine, and we had a meeting with the Department of Disability yesterday, who loves our model because it's simple and because it's transparent and because it can get patients to doctors now in more than one way. The exciting thing is we keep adding people, something like a Healant and an Expert Care. They could be part of our network. That's the exciting part. And then we also are looking at partnerships down the line to do the second step. The first step is cash. What about the prescriptions? What about the procedures? What about everything else? And we are having everyday meetings with people who want to partner with us. So why is this important? Well, if every independent doctor opened one appointment slot, or any doctor opened one appointment slot per week for direct pay, it would generate massive amounts of money for UberDoc, because all we need is 1 or 2 seats in everybody's waiting room. That waiting room now is not just a waiting room that's actual, it can be a virtual waiting room. And how big is this market? Well, the direct pay market has been explosive. I mean, $19.1 billion, but that's not even scratching the surface. People have been paying copays, deductibles. They have been paying to go to walk-in centers. Urgent cares is a huge volume. There are 500 urgent cares in Massachusetts, more than there are zip codes. And people have been going to urgent care and paying $250 off of their deductible every time. There are 27 million people out of work. There is going to be a huge shift toward people who are going to move out of employer-based insurance and into high deductible plans, and they are going to need an option, and UberDoc can be that option. And of course, there's a huge second opinion marketplace that's growing exponentially on the global scale, and UberDoc fits into each one of these very easily. So the total addressable market is huge. So who is actually using UberDoc? We have this army of doctors. Do we have the patients? Well, if you look on the right, back at the, in 2019, we opened up our model. We started with just 6 surgical specialists, and we rapidly expanded to all doctors. People came to us and said, why can't we be on your platform? So we expanded our network of doctors. When we hit a critical mass of about 300 or 400 doctors, we said, let's dial it in to the patients. Let's use direct-to-consumer digital marketing strategies through SEO and through Google AdWords, and can this work? And that's that spike. We did our market test. It worked. Then we said, well, we worked, but our cost of acquisition was high because we only had 300 doctors. Let's put all of our resources toward getting doctors, and that's what we did. And you can see when COVID hit, the patient population actually stayed home, but our traction amongst our doctors went up exponentially, as did our traffic on our website. Who uses it? It's men and women, about the same. 60% are between 35 and 55, middle class income, and you can see the top specialties are psychiatry, urology, pain, and orthopedics, but really internal medicine and all the other specialties are also asked for. So we thought on the patient acquisition side, not just digital strategies, but we have met with employers and, more importantly, employee benefit brokers. We met with them early on. They said, you build this, we will come. For many reasons, this flies below the radar. It is off the books. It's not something that insurance, it's not something that would create a claim. So it's really important in terms of their negotiating their rates the following year. Obviously, self-insured people, COVID-19 testing companies have come to us that they need doctors. They need a network of doctors to provide COVID-19 testing for all of the government-funded programs, and we are participating in that. We have government partnerships, again, as GSA and as a government vendor, and also working, believe it or not, with the military, who thinks that this is a really good way to be able to get their active duty connected to specialists quickly. And of course, the concept of virtual urgent care, which is really going to kind of evolve as we realize that we have so many talented and experienced care doctors.
1 minute.
We make money in two ways. We have a subscription model, and we also are transactional. Obviously, the cost of acquisition for the doctors, it doesn't cost us much to get an enrolled doctor. Doctors sign up right away when they subscribe to our telemedicine platform. That costs us a little bit more, and there's a big margin. We also sell to the doctors, sell to the patients, and we take a transactional model, and it is robust. Our revenue projection, we have been both with recurring revenues from subscription and transactional revenue has growing very nicely. And really, this is all related to this exponential doctor network that continues to grow. And we see more and more opportunities with partnerships as we go. We have a lot of competitors in the marketplace, but no one does direct pay and no one pays the doctor at this level. Teladoc pays their doctors $20. Our doctors get $200. These are independent doctors working for themselves and reinventing themselves in this new marketplace. And that's what is exciting. We're giving them a complete digital office. Plenty of exit opportunities. There's people in all aspects of people who want to monetize, people who need our doctor network, but ultimately to become that market leader where we really do create this doctor-patient marketplace would be terrific. We have a great team that work with us. We have also economists as our advisors.
All right, thank you, Paula. You're running out of time.
Okay, I'm